The star of ABC's Nashville suffering from postpartum depression and has now checked herself into a treatment center. ABC's Juju Chang is here with her story. Good morning, Juju.
Good morning, Robin. You know, the former child star is a talented actress and singer and model with a picture-perfect engagement to a champion heavyweight boxer. But Hayden's been so candid, so open about her struggles with depression after her baby was born. She's a stark reminder that postpartum issues can affect anyone.
It may be a case of life imitating art. Nashville star Hayden Panettiere's rep telling ABC News Tuesday that the actress is voluntarily seeking professional help at a treatment center as she is currently battling postpartum depression.
Help me get my life back.
Panettiere, whose character Juliet on the ABC show Nashville has struggled with postpartum depression, opening up about the anguish she shares with her on-screen counterpart on Live with Kelly and Michael 2 weeks ago.
You don't realize what broad of a spectrum you can really experience that on. It's really painful and it's really scary.
The first-time mom to 10-month-old daughter Kaya is just one of 600,000 moms across the country diagnosed with this form of depression each year, with common symptoms like difficulty sleeping, high anxiety, and frequent crying. The condition can easily take a toll on what's supposedly one of the happiest times in a woman's life.
And no, I don't have that postpartum, whatever the hell you call it.
Panettiere has acknowledged the physical changes that come with motherhood, posting this photo on Twitter Saturday with the caption, "Feeling like I'm finally coming back into my own body." This morning, Panettiere in treatment, facing the condition head-on and addressing the shame and stigma that are usually attached to it.
There's a lot of people out there who think that it's not real. Women need a lot of support.
And you know, there is still a lot of misunderstanding about postpartum, which can be deeply hurtful. People brushing it off, saying, oh, it's just hormones, or it's a matter of willpower. And Hayden said it best herself. It is so painful, so scary, and people do need that support. Robin?
Yes, Juju, thank you. Joining us now, ABC News senior medical contributor, Dr. Jennifer Ashton. I saw you watching that piece, Jen. Juju touched upon the symptoms. Elaborate for us, please.
You know, after delivering over 1,000 babies, I've seen my share of moms dealing with this, and all I can tell you is it is not subtle. These women are desperate. They feel disconnected. They feel completely overwhelmed. There is profound sadness and fear, and that social stigma on top of it. And we do hear the things that Juju mentioned. We hear people saying, you're just tired, you know, you're just adjusting, you just need some rest. This is way beyond this. This is a medical emergency, and in extreme cases, when that woman feels like she might hurt herself or has thoughts of possibly hurting her baby, she needs in-hospital treatment. This is a medical emergency.
Get help right
Absolutely.
away. So, causes, risk factors here.
Well, you know what, we know some risk factors. Obviously, a woman who's had depression or has suffered with postpartum depression is at increased risk. And in terms of why women experience this, we don't totally understand. Yes, there are profound hormonal changes in the brain that occur in pregnancy and postpartum, but this is also biochemical. And I really encourage people, think of this like blood pressure. If you had high blood pressure, you would treat it. This is no different. This requires aggressive treatment.
So talk about the treatments. What are the treatments?
Well, look, the mainstay in a situation like this is psychotropic medication or antidepressant medication. There is also some exciting research that's still really in its infancy about hormonal therapy, thinking possibly estrogen supplementation can help. And then psychotherapy, cognitive behavioral therapy can help. A range of complementary therapies, acupuncture, exercise, light therapy, some dietary supplements. But to be clear, you need all hands on deck here. We need social support. We need medical support. Because remember, there are two lives at stake in obstetrics. Always. There's a mom and there's a baby, and they both need to get better.
Oh, I can see how this is really impacting you and how important this is. Yes,
and we have to give her props. This is a situation where she would like her privacy, but she's helping so many women with this awareness.
Discussion is so important. Get the help. And Dr. Ashton will be online. She'll be on Twitter. Any questions that you have, please reach out to her. Michael?
All right. Thank you, Robin.